If my patients have just liposuction, I'd give them a day. Most of them will go back to work the day after. The biggest thing that you see when you do liposuction under tumescent anesthesia is that you're putting 2 or 3 liters of fluid under the skin. And so when you're finished, even though you suction, there's still a lot of fluid that's just in the abdomen. And when we're done, we put a compression garment on them, which is almost like squeezing them out like a sponge. And that night they will pass a large amount of fluid. Now you have to warn them ahead of time, because it's going to be a little, as any OBGYN will tell you, a little bit of blood and a lot of fluid. Looks like a lot of blood, but it's not. What I normally tell them is that if they're not forming a clot anywhere on their compression garment, then it's nothing other than some blood-tinged fluid that's coming out. It can be quite impressive that first night, the amount that they have, but by the next day it really slows down, and by the evening of that second day it's essentially stopped. When we do our procedures here, we don't need to close the incisions. I usually put a single suture in just to make the edges line up so they heal better, but they could very easily, that evening, their garment will be stained. They'll probably want to take it off. They may want to have a quick shower, and that's fine. A number of ours will put a second garment on that night. Some will, that first night, will just sleep with a big thick towel wrapped around the area. But it's very important over the next few weeks to keep that garment on all the time in order to make sure that the areas that you've liposuction heal back down to the underlying fascia in an even fashion. But as far as being able to do activities of daily living, they have no troubles whatsoever.